Om Swastiastu. Good morning. We are from SGD B2, the second semester of PSSKPD 2021. Today, we would like to present our student project presentation, which title is Faeces Examination and its Clinical Implication. Before we start, I would like to show our members that will do the presentation. Next. Now, let me introduce myself. My name is David Christopher Tjandra. My last three digits of student number is 066. Now, I will explain about the introduction. First, as time goes by, the medical world is always faced with various types of diseases that are rampant globally and continue to occur from time to time. One of the diseases that always cause big problems and has become worldwide is microbial. Based on its prevalence in 2017, there were around 1.7 billion cases of diarrhea around the world, which mainly affects children every year. One of the examinations used to check for diseases caused by parasitic infections, especially in cases of intestinal parasites, is a Faeces examination. Its general purpose is to obtain data that serves to establish a diagnosis of diseases caused by gastrointestinal microbial disorders. In the Faeces examination, the researcher will do both macroscopic and microscopic examinations to assess the results. In the examination of gastrointestinal diseases, Faeces examination is considered very effective as it directly focuses on the specimen where the disease-causing parasite is extricated. Behind the full general knowledge and theory for this examination, further research is still needed to understand what the clinical implications of the Faeces examination are to support optimal diagnostic results. Thank you. Now next.
Morning, I'm Nevinne Nathania Susanto. My last three digits are 051. Now I'm going to be continuing the presentation. Next. First is the problem formulation. 1. What is a feces examination? Second, what are the clinical implications of feces examination? Third, what are the interpretations of feces examination? Next. Next, I'm going to explain about the objectives. First, to describe feces examination. Second, to know the clinical implications of feces examination. And third, to find out the result interpretation of the feces examination. Next. For the benefit, we can divide it into first for the public community, which is to introduce the public about feces examination. Second, to inform the public about the clinical implications of feces examination. And third, to increase public knowledge about feces examination and its clinical implications. Second, for the institution, we can add sources of knowledge about feces examination and its clinical implication as a learning material to introduce students about feces examination and its clinical implication, and also to improve the quality of learning material about feces examination and its clinical implication. And last, for the academicians, this paper can be used for medical education resources to improve literacy skills and conducting research, and also to practice gathering information from various reliable resources. That is all from me. Thank you. Next.
Good morning, I'm Edgar, and my last three digit of student number is 045. Now I'll explain the definition of fecal examination. Next. Faeces is a kind of body waste material that is excreted after food digestion and discharged from the bowel. An examination that is done to faeces can indicate some condition, especially those that affect the digestive tract, such as an infection that can be endogenous and exogenous, ulcers, hemorrhoids, diverticular disease, or even cancer that are important for diagnosis purposes. The fecal examination can be done in various ways, such as macroscopically, microscopically, microbiologically, immunologically, and chemically. Next. The purpose of fecal examination: to determine the presence of ovine parasite, fat, bile, and pathogen present in the human body, to detect the presence of fecal urobilinogen, nitrogen, Clostridium difficile, fecal leukocytes, calculation of stool osmolar gap, food residue, and other substances. That's all for me. Thank you.
Good morning, I'm Fernando Ghosali, and my last digit of student number is 036. Now I'll explain about chemical component that is needed in a fecal examination. Microscopic analysis of the faeces is the most critical stage in detecting stool abnormalities and intestinal disorders. Protozoa, helminths, and fecal leukocytes may all be identified by microscopic inspection. The following approaches can be used to investigate the faeces. The first is saline wet mount examination. A wet mount examination is the easiest technique to look for motile bacteria in a bacterial solution. The second is iodine preparation. Because iodine stains the glycogen in ovine case, it allows for improved observation of morphological features. The third is buffered methane blue stain. Place a little flake of faeces or a rectal swab in a drop of 0.05% methylene blue solution on a clean glass slide and analyze it. The fourth is cellophane tape test. The egg of Enteromonas vermicularis are collected from the perianal region using an NIH swab. The fifth is concentration method. In a white mouth container, a tiny film of faeces is emulsified in saturated salt solution. When the faeces is homogeneous, a few drops of saturated saline solution are added, followed by additional saturated saline solution. The flotation technique basic principle is as follows. Because OVA and case have a lower specific gravity, they will float to the top of the saturated salt solution and adhere to the underside of the glass slide. That's all from me. Thank you.
Good morning, I'm Komang Ayu Widhiani. My last 3 digit of student number is 044. Now I'll explain about steps of our procedure of fecal examination. Stool examination begins with taking a sample of the patient's stool, that is specimen collection. The container containing the feces specimen should be clean and dry. There should not be any urine left over or any other materials. Next, the stool sample will be taken or transferred to the laboratory to examination. The specimen must be delivered as quickly as possible and better to keep it in the refrigerator during the process of delivering. The next step is macroscopic or gross examination. Macroscopic examination includes inspection of the stool consistency, form, color, odor, and sign of pathological condition. The last step is microscopic examination. Microscopic examination of feces is primarily aimed at finding protozoa, larvae, and worm eggs. Now let's move on to the next topic, handling and preservation of feces sample. Feces sample are handled in a plastic box after they delivered to the laboratory on ice within 24 hours. 1 gram of feces sample is then put in a 5 milliliter centrifuge tube and subject into a process called lyophilization. After it is done, the sample should be stored at a temperature lower than 4 degrees Celsius after collection and before lyophilization. Lastly, the sample are kept at -20 degrees Celsius to -80 degrees Celsius. There are other several methods which are using 5 of potassium dichromate, 95 ethanol, formaldehyde, Paxgene, two-step desiccation ethanol silica gel, FDA cards, and RNA letter to maintain the quality and preserve the feces sample. That's all from me. Thank you.
Good morning, my name is Yovilia Tio Yunus and my last 3 digits of student number is 035. Now I will explain about clinical implication of fecal examination. Generally, stool examination is performed on patients who come with complaints related to the gastrointestinal system. The following is a brief description of some of the diseases that can be diagnosed through a cause check. The first is hematochezia. Hematochezia is a condition where there is a bright red color in the stool. Hematochezia findings mainly include bleeding in the lower gastrointestinal tract, bleeding in the large intestine. The second one is Crohn's disease. Crohn's disease is a form of inflammatory disease caused by an excessive immune reaction, causing inflammation in many areas of the gastrointestinal. And the third is ulcerative colitis. Ulcerative colitis is another form of chronic inflammatory disorder of the gastrointestinal tract apart from Crohn's disease. That's all for me. Thank you.
Good morning. My name is Nyoman Ayu Widhiani with 3 last digit of study number is 070. Let me continue the presentation. So, next there will be diarrhea due to parasitic or bacterial infection. Diarrhea caused by bacterial infection can cause several symptoms such as nausea, vomiting, fever, abdominal cramps and pain, and bloody diarrhea. Next is colonic adenocarcinoma. Colonic adenocarcinoma is a type of malignant cancer originating from the large intestine tissue consisting of the colon, rectum, or both. Next, there is amobicolitis. Amobicolitis is an infection of the colonic mucosa caused by Entamoeba histolytica. Last, there is eosinophilic colitis. Eosinophil colitis is a condition in which eosinophil accumulate in large numbers in the colon, causing sores and irritation. By knowing the diagnosis and causes of the disease, clinicians can determine the next step in treatment so that patient can be treated properly according to their needs. So that's all from me. Thank you.
Good morning, I am Gusti Agung Saraswati, my last 3 digit of student number 056. Now I will explain about fecal examination result interpretation. Analysis of stool include macroscopic, microscopic, and chemical examination. Macroscopic examination of feces was carried out by looking at the consistency which was divided into 5 types including loosely formed stool, waterized stool, dry or hard stool. Number 2, colors. The colors of the stool vary depending on the condition. Some are yellow or green. Diarrhea usually occurs. Some are red. Usually there are inflammation in the digestive tract, dependent on the condition. That's all from me. Thank you.
Good morning. My name is Marta, Vitti, Lawi, and my last 3 digits of student number is 064. Now I will continue my friend's explanation. Third, quantity. In routine examination, the normal quantity of stools is 100 to 200 grams per day. The quantity may vary from the diet, age, and gastrointestinal tract disease. Fourth, odor. The stool odor is caused by the indole and scuttle formed by the bacterial fermentation in the large intestine. Foul and sickly odor are caused by undigested protein, lactose, fatty acids, and excessive amounts of carbohydrate. The last is the presence of blood and mucus. Mucus is made by the mucosa of large intestine in response to parasympathetic stimulation, so it's normal to find mucus in stools. However, stools with a large amount of mucus and the presence of blood, black or red colored, are sign of abnormal condition in the gastrointestinal system. That's all from me. Thank you.
Good morning, I'm Amanda Devasya. My last 3 digits of student number is 068. Now I will explain about microscopic examination. Microscopic examination of the stool is done to look for the presence of first leukocyte. Normal stool has 0 to 1 leukocyte. The increased number of leukocytes in stool indicates bacillary dysentery. Second, RBC. The presence of RBC in stool is caused by hemorrhoids and dysentery. Third, macrophages. Macrophages and epithelial cells in stool are caused by inflammation of the bowels. Fourth, fat. Fat and muscle can be found in stool because of malabsorption and deficiency of pancreatic digestive enzyme. Fifth, eggs. Eggs and seeds of parasites in stool are commonly from protozoa and helminthes. That's all from me. Thank you.
My name is Janice Wijaya. My last 3 digits student number is 037. And now let me continue the presentation with the interpretation of the chemical examination result. So the chemical examination of faeces includes the stool pH, reducing substances in stool, and the occult blood that found in the stool. The first one is the stool pH. Stool pH is very dependent on the diet and the bacterial fermentation in the intestine. Increase in pH indicates colitis, pilus adenoma, diarrhea, and the antibiotic therapy. Besides, decrease in pH can be caused by the fat and carbohydrate malabsorption. Second one is the reducing substances in stool. This method is mainly used in infants with chronic diarrhea to rule out the lactose intolerance. Last one is the occluded blood. This method is mainly known as the fecal occluded blood test, and this can be a sign of malignancy in the gastrointestinal tract. In this test, the color changing from green to blue can indicate the presence of the occluded blood in the specimen. That's all from me. Thank you.
Good morning, I'm Mahayana Putra. My last 3 student number is 050. I will explain about the summary. Fecal examination is a type of examination that is done in order to find indication of certain condition, especially those that are associated with the digestive tract, such as ulcers, hemorrhoids, or even diverticulosis and cancer. There are many ways to conduct a fecal examination, such as macroscopically, microscopically, microbiologically, immunologically, and chemically. Fecal examination is performed when a patient shows symptoms such as diarrhea, constipation, anorexia, dysentery, or other symptoms. Through the examination, the patient can find out the underlying cause of symptom and also be given an appropriate diagnosis, so further therapy and medication can be given accordingly. Fecal examination is associated to detect the presence of certain substances such as fecal urobilinogen, nitrogen, fecal leukocyte, and food residues. That's all from me. Thank you.
Meikel Wibisono. My last 3 digits of student number is 061. Now I'll explain about the recommendation. So we have to know that stool examination has an important role, which can be used to detect diseases or disorder of the digestive system. The stool examination is considered very important so the doctor can find out the presence of egg cells, parasites, and others in the human's body, and also can form preventive measures or diagnosis. And also by understanding the clinical implication of stool examination, doctors can detect diseases of the digestive system and can gain knowledge in the future. And also this research is also favorable for us, the writers, in understanding more broadly in the lecture material for our research, this time faeces examination and its clinical implication. Next.
Okay, that's all for our today presentation from SGD B2. Thank you for listening and giving your attention. We are very sorry if there are some mistakes during our presentation, and we hope that our student project can inspire and motivate lots of people based on its benefits. Lastly, I would like to close it with the Paramasanti. Om Santi 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 Om. Thank you very much.